And thank you everybody for tuning into this video. My name is Frey Crook. I am the Secretary of Life Tech, and I appreciate you tuning into this. Life Tech, very quickly, is an organization that is dedicated to pro-life issues from a technical viewpoint. And by pro-life issues, I mean everything from conception to end of life and everywhere in between. Everybody associates a lot of pro-life issues simply with the debate on abortion, but of course we're interested in a scientific, a technical discussion on things like, euthanasia, quality of life issues, and so on. So we try to look at the complete spectrum of all those issues. And I'm delighted to have with me today Dr. Marilyn Singleton, coming to us from California. One of the I'll call it a nice thing about COVID is that we can kind of cast our net a little further as we've gotten better with our kind of remote engagement technology, so that we can look for more voices to add to our site and our discussion. So, Dr. Singleton, welcome. Thank you for taking the time to join us.
Well, hello. I am just so happy to be here. And I'm an anesthesiologist and have been for many, many moons. And mid-career, I went to law school at UC Berkeley Law School so I could learn how the sausage was made. And pro-life has always meant something to me. I grew up Catholic. I kind of feel like when Catholics really adhered to the catechism, and before politics was always injected into everything. And I was so thrilled to find out even about your group. I'd never heard about it before. And it warmed my heart to just think that there's a whole other group of people who are looking at these issues. And I write op-eds now that I'm retired. And I had written an op-ed not too long ago called The Soylent Green New Deal. And for anybody who's looked into sci-fi, it was when there was no more food in the world, and people, before they were ready to die, they got to look at their favorite video, and then the hero discovered that that's what happened to people after they looked at their favorite video. They were put on a conveyor belt and turned into food. And it really bothered me, that made me write this op-ed, because in Washington State, they said it's okay now to bury humans in regular ground and use them as compost. And I thought, okay, where has respect for life gone? It's called out the window. And so anyway, my topic today is how COVID has changed medicine. So we won't get into my whole euthanasia and eugenics spiel, but we'll talk about COVID. I know everybody's zoomed out, and I'm not going to do a slow death by PowerPoint. And I know we're all sick of COVID at this point. I'm sure by next year we'll never want to hear the word again. But we all know there's been unnecessary death. Our lives have been disrupted. We haven't seen our families. But the worst part is injecting politics into medicine, and really the ruination of scientific integrity. And this can have long-lasting effects. Science is not something that Dr. Fauci gets to define as a fixed thing. All through the years, and everybody in their own profession has very famous scientists who were mocked and tortured, some even guillotined, for having different ideas. And certainly in medicine, we have Ignaz Semmelweis, who discovered that you really shouldn't go from an autopsy and then go deliver a baby without washing your hands. The simple thing of hand washing. He was mocked. He was derided for coming up with that idea. And then more recently, we've got Dr. Marshall, Charles Marshall, who was derided for saying that spicy foods were not the cause of peptic ulcers, but rather a bacterium. And I mean, universally, it was, ha, 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 what a moron you are. And even left out of a medical society because of it. He ultimately drank some bacteria got a peptic ulcer, took antibiotics, and made the ulcer go away. And guess who won a Nobel Prize? The same fellow who was mocked. So that's science. So the idea that science has been ruined with this COVID epidemic is really rather sad. And I hope that the way we're using science now doesn't continue. I mean, we've had a lot of pandemics. There's been swine flu, bird flu. The swine flu in 1976 was a real example of a botched vaccine, and that they pulled off the market right away. We'll get to that when we talk about vaccines. It's like, why are we allowing so many side effects to accumulate in this when we didn't allow that to happen in 1976 after only about 50 cases of Guillain-Barré, which is a paralysis that starts at the feet and then works its way up the body till it paralyzes your lungs. They pulled the vaccine off the market. But guess what? Everybody else lived through it. Magically, they were fine. And even though we ended up not having a vaccine for that big pandemic.
Question, if I could, on that.
Yeah.
I'm just curious as a matter of statistics. They actually pulled, or was it momentarily stopped, the Johnson's and Johnson's vaccine because it was picking up with people with certain backgrounds. I believe there was a bleeding risk.
Right.
When you're looking at vaccinations, and I think we're far more sensitive, to the not one person must die about this. Well, what if you're saving 6 million? What would normally be considered a good outcome as far as looking at it? And sometimes it's so hard to figure out what the actual cause of death was because human bodies are complicated. But what would be acceptable? Would it be like a 6 sigma value as far as if you had some people who, with a particular vaccine or medication, would die, but you're helping how many other people? What's the balance there?
Well, it's interesting because it certainly changes depending on what the medication is and what the risk of you getting that disease in the first place. And it's something I briefly mentioned, but I'll say it now. One of the flaws when I talk about not using the science is throwing out the relative risk number of if you take the vaccine versus if you don't take the vaccine versus the absolute risk of you getting COVID. And it always reminds me of, oh, guess what? They raised my salary 100%. And it's like, well, what does that mean? You could have been making 1 penny before and now you have 2 pennies. It doesn't really tell you real numbers. And that's one of the biggest travesties with the whole vaccine thing, because the absolute risk reduction, it's Pfizer is only 0.7%, and Moderna is 1.1%, I believe. So and generally efficacy wise, they're looking for something greater than 55%, which isn't very efficient. That's just about the border of where we have the flu vaccine from year to year to year. And when you look at how few people actually take it, only about 40% of people take it, and you have 40% of people with a 55% efficiency and sometimes even less, you really don't get that much from the vaccine. And now we're finding that these vaccines are really not that efficacious. And again, were we to follow the science, we'd know that.
Do you think that there's a gap, and I'm not sure if you call this an education gap? I think it's fair to say that people don't understand day-to-day application of risk and statistics, and these numbers are misused all the time. But for example, I believe it's like a 1 in 300 or 1 in 400 chance of being hit by a car in a given year time frame. And yet you don't see anybody deciding to adopt horses as a means of just walking around from place to place, while the risk of having a bad outcome from a vaccine injection or rather not having the vaccine injection, really either way, are so much worse. Yet everybody seems to just go crazy over these edge cases where the possibility of you having something wrong would be about the same as saying getting struck by lightning while a meteor crashes on you.
That's right. But so much of that is how they decide to frame the issue. I don't know, and I'm sure somebody in this audience has read that book, Freakonomics. And I remember when it came out, something that one of the authors had said is more children die from drowning in swimming pools than they do from having an errant gunshot accident at home. And so we hear about gun control, but nobody says swimming pool control. And he calls that the outrage factor. And that's for sort of those social issues. And when it comes to these medical issues, I think part of that is that syndrome of thinking that we should be able to change everything and we should be able to stop everything. Because wasn't it, to me, one of the dumbest things I've ever heard in medicine when they started saying, we're going to stamp out COVID, it won't be around. Well, guess what? SARS-1 and SARS, the severe acute respiratory distress syndrome. That's how the name of the virus that causes COVID, SARS. And it wasn't SARS-1, first time, but that was in 2002, 2003. Okay, it had about a 10% infection fatality rate. And, it wasn't a pandemic. There weren't that many people that got it. And it dissipated after about 18 months. But every now and then it'll pop up. The same with MERS. That was Middle Eastern Respiratory Syndrome. That was much more deadly, 34% infection fatality rate. And it still pops up every now and then. And that's after it sort of faded away. Now, we can decide there might be a couple of reasons why COVID is not fading away as fast as the first SARS and the MERS, because, okay, we've all read it, and now because of the gain of function work that was done in the lab. And so looking at its origin, that if it really did come from a pangolin, which I, of course, had to look up and see what it was. It's a terribly ugly little animal.
They are.
And, if it really came by what's called zoonosis, where something jumps from an animal to a human, then it probably would act more like SARS or MERS, where after a while it just dissipates. If, in fact, this was created in a lab, which more and more information seems to show that, even though nobody's going to come out and say it, and so far everybody seems to be lying about it, definitely there was so-called gain of function work done. Now, gain of function makes a virus more virulent. That's why they do it. When Dr. Fauci and others are asked, why would you do such a thing? They say, oh, well, that helps us make better vaccines. And a lot of people turned up their nose at that explanation, that it sounded somewhat bizarre, and it sounded more like, oh, because we're making a bioweapon. And, I don't want to get off on the fringes, but you have to think about such things, and people do think about such things, because it could make the disease of COVID hang around longer if, in fact, this were something that wasn't a naturally evolving viruses. There's trillions of viruses in this world, and they've been evolving for years and years, but we have natural immunity and they cross over. And like with the coronaviruses, there's 7 of them that we have circulating around in humans. 4 of them cause about 30% of common colds. So they're out there, and it's just interesting how this one got to be so transmissible and made you much sicker than a common cold, even though it's a very similar looking virus.
Interesting. I'm interested that you brought that up, because when you brought up MERS and SARS, I think that the general consensus is that those were indeed a virus that mutated so that it could be given to humans. But in both cases, if memory serves, it wasn't terribly good at human-to-human transmission. So that's why you didn't get the same kind of epidemic. Where, on the other hand, if you were doing gain-of-function research in, let's just say a lab, and let's just say in China, then you would be developing something specifically to have that human-to-human transmission. And then suddenly you have a virus that, A, typically from the other examples does transmit very well from human to human. And apparently, with the latest strain of the moment, does a pretty good job of going from
Mhm.
human to human. So wouldn't that be an indicator that maybe since it acts differently, we always want to look for the outliers, than all of these other viruses, then that seems to indicate that this virus developed a different way than the normal animal to human route?
Absolutely. I mean, you explain that very well. And this is why when you go through your two theories, one, it jumped from a bat to a pangolin to a human who ate this pangolin in the wet market, or you were at the Wuhan virology lab which had our gain of function. And now this is verified. This is not conspiracy theory.
Yeah,
Dr. Francis Collins said it. Dr. Fauci may have lied during his
yeah.
questioning by Rand Paul, but that we were doing gain of function research. And it was put over into China after it was outlawed in the United States. So we funded gain of function research in that Wuhan lab. And there's been a long history of viruses and bacteria escaping from labs. There's several labs in the United States that have had escapes, so there's no reason. So then, if we go down this algorithm, where did this come from? And we decide, okay, pangolin's out, gain of function work in the Wuhan lab. Then you have another branch off. Did it escape from the lab because it had poor security,
Mm.
or was it let out of the lab on purpose? And that's where, certainly we can all diverge in our thought of what happened there. And of course, that's going to be something very hard to prove. And given that the committee to examine that included some of the perpetrators themselves, it makes one wonder whether we'll ever know the truth about that.
Well, yeah, it would be like taking from a few years ago. It's like leaving Enron executives in charge of investigating Enron for excessives in the gouging and manipulation of the energy markets. You're probably not going to trust the results over much.
Exactly. So whatever we find out, we just have to keep on looking. But I just say, certainly, as people who are investigating this, virologists, immunologists, infectious disease people, are doing the best they can with what they have, but keeping in the back of their head that if this is something that isn't a natural evolution of a virus, that it would make it harder to eradicate, even though, again, you never really truly eradicate a virus. And remember not to anthropomorphize it, but viruses want to live. So when they mutate, they do not mutate to where they're more virulent, more deadly, because they need hosts. And so that's why generally as they mutate or get variants, that they will be less deadly. But again, we don't know if that's going to be the case with this, if in fact it was man-made. So there's a lot of little ifs that go in there because we don't know the origin, the true origin. We know what it is. There is a genetic sequence, and that's how they came up with the vaccine so fast. And it took 42 days after they got the genetic sequence to come up with that messenger RNA vaccine.
So the
But
next step, if
go
I
ahead.
may, is
Mhm.
that so I think that you and I are probably on the same sheet of music, and I think we're in agreement that this did in fact originate in a Chinese lab. I think that all the evidence, as it's been coming out in little dribs and drabs, uh, unwillingly at times over the last year, indicates that. So now it's out in the wild, and we're coming up with these mRNA vaccines as part of Operation Warp Speed, which, I mean, from a technological standpoint, I think that these are fascinating. I think the possible applications for in cancer research are particularly interesting. However, and what I'd like you to talk about is that we had COVID, and then now we have Delta. But the number one, and I know we have a lot of others that are out there. There's a Brazilian variant. That's I don't remember, Gamma, I think it is. But
Right.
there's also most of the people that are being infected in Great Britain right now have the Alpha Y variant. So I don't recall, and part of this is improved technology to tell what the genetic differences are. But I don't recall things like the MERS and SARS or some of the flu viruses that you had such a rapid proliferation of different strains. And what I'm wondering is that where the mRNA, I'm not going to debate necessarily the efficacy in general, but were they so specific to a very, very tiny subset, I guess, of all the potential coronaviruses, that if there was a mutation that was different than just by a small amount, that mutation may not be as efficient as infecting the host, would be able to infect it enough that it would almost be like a typhoid Mary kind of setup, where that variant would now be able to be transmitted to others. In other words, I think of our immune system as like, throwing a grenade. It kind of takes out the virus, and anything that looks like it's virus is not being as discriminatory. It's much more heroistic. While the mRNA seems almost too specific, so that something with a slight difference might slip through the cracks. Would that be accurate, or am I wrong?
Well, okay, that kind of jumps me to my section on natural immunity versus the immunity of the vaccine. This and okay, just kind of going back, what makes you sick with the SARS virus is it attacks the so-called ACE2 receptors, and that stands for angiotensin converting enzyme dash 2 receptor. And those manage blood pressure and other functions of the body. There are lots of them in the lung, in the nose, they're in the intestine, they're everywhere. So that's why you get this systemic disease. So that spike protein goes inside the ACE2 receptor, and if it gets that, leads it into the cell, and then that's where the virus starts to replicate. And so certainly the various treatment options, you can try to stop the virus before it even gets in, stop the replication once it gets in the cell, or try to treat some of the damage that happens because of the inflammation that your body normally reacts. That's, oh, I see a foreign body, I'm going to react with inflammation, and then it gets out of hand, and that's how you get the cytokine storm, and that's when people get very sick. Cytokines are the little proteins that cause the inflammation, and so they don't manage themselves, they don't regulate themselves very well. So you go back to that. If you see the whole virus, that's going to look like this and have the little spikes coming out, your body's going to see the whole thing, and it's going to see all the spikes, which might be a little different. Each spike might act slightly different. And so when it makes the antibody to that, it's seeing that whole thing. It's seeing more. This mRNA vaccine is a certain spike protein. So you're making antibodies to that singular item. And it's interesting how this comes out when they talk about why some people don't get that sick, why some do, that they're assuming that there's a lot of crossover immunity from having had other coronaviruses. But again, you had the whole virus. So maybe there was another little spike on that cold, that really bad cold you got 2 years ago. And so your deep immunity may recognize when you get this new coronavirus that says, well, hey, I know that virus. I know it's 60%, but I know it well enough to not let me get super sick. So, and when we talk about immunity and the natural immunity versus the immunity you get from the virus. So one, it's too specific. That's why almost all the outbreaks are with the Delta variant, because the mRNA vaccine was made for the alpha, the original strain, and it doesn't really adapt. And that's why they had to change the definition. Good old follow the science. Had to change the definition of vaccine. The vaccine is supposed to keep you from getting infected in the first place. Okay? Suddenly they changed the definition where it supports immunity. It's suddenly gotten very squishy what this vaccine does, but it's not like a measles vaccine that if you get the measles vaccine, you do not get measles. Obviously, there's going to be a few outliers that do, but this does not work that way. And it's likely because it's hyper-specific. And so when you do get a variant, there's not enough global immunity unless that's why getting into why kids aren't getting sick, because one, they don't have a lot of ACE receptors, but they have a lot of T cells. The T cells are made in your thymus. That's why they're called T cells. And that's your longer lasting immunity. And as adults, your thymus pretty much just disintegrates. It's up here. And you can't feel it or anything from the outside. Kids' thymuses are big because they're making all this immune stuff. And then over the years, it shrinks. And kids do have better immunity than adults as you get older and older, although as adults, there are things we can do to help enhance our immunity. So you have the T cells that are probably recognizing things that are similar. It's kind of like a cousin, a brother, not necessarily that person, so to speak, that was the original virus. And then you have the B cells, which a lot of people think they're called B cells because they're in bones, but it's not. It's named after a part of a bird, which is kind of interesting trivia. So but the B cells in the bone, which of course no one's measuring because you'd have to do bone marrow aspiration, those are the ones that really carry a broad immunity and can do that crossover, let's call it, where if you were sick from one kind of coronavirus, it might cross over into the next. But one of the reasons, how for years that used to be the old joke, if they can find a cure for X, why can't they find a cure for the common cold? Well, part of it is because 30% of common colds are coronaviruses and they just mutate like that. So this is one of the things when people are talking about following the science. One of the first things, and first I'll say, anything that happened in the first 3 months, I forgive. People didn't know what was going on. Obviously, some people knew because they knew where that virus came from. But we'll say for the general community, the general medical community, people didn't know what was going on. So anything anybody did, it's like, okay, fine. Once data started coming in, where you knew what the virus was, you knew what the mechanism of action was. It wasn't just a lung problem. It wasn't like just pneumonia, that it was a systemic problem because that spike protein gets inside the lining of blood vessels and causes inflammation in there. And that's this whole idea of getting blood clots, and the way people were dying and whatnot was very different from a regular flu or regular pneumonia. And the whole follow the science just started falling apart. They should have started saying, certainly even before they knew what it was, enhance your immunity. And I find it very bizarre that now that the vaccines are out, you go to the CDC website and they have a section now. It wasn't up before. How to enhance your immunity. And they're saying all the things we were saying a year and a half ago. Vitamin D, get outside, get some sunshine. And it's been shown that high levels of vitamin D, 54% reduction in going to the hospital if you have a normal vitamin D versus those that don't. And
doesn't that go beyond COVID? Just talking about vitamin D, that it's actually been shown to have, and I'm talking naturally generated, not from the pills.
yeah,
That just having additional exposure to sunlight and getting the vitamin D generated actually affects a number of potential issues, even involving things like aging and such. So that's just a very healthy thing to do.
that's right. And vitamin D was kind of given short shrift when they think about vitamins that are so essential. And it's really super, super essential, more so. And which made it so perverse that people know this about vitamin D, yet what did they tell us with the COVID? Lock yourself in your house. And
Yep.
my personal feeling about these poor oldsters that, as far as I'm concerned, were killed in the nursing homes, that one of the reasons they did so poorly, if one, they were frail, that's why they were in nursing home in the first place, and two, generally speaking, people in nursing homes do not get outside. Some of the more lively
Yep.
patients in a nursing home, they usually have a little patio they can go out, but that's probably for 15 minutes at best while they're wrapped in a little blanket. And so they had every factor going against them: age, frailty, and probably had no vitamin D at all in their system. So it's no wonder that they died. Um, so other things that we could have been told to do, and the other interesting thing, exercise. Early on, they found people who exercise had better outcomes, and that wasn't just because of age, but because COVID is age stratified. 80% of people who die of COVID are over 75. So we know that, and then you look and it's 0.003 if you get all the way down to younger people that died. And those young folks that died, as it's turning out from what we can tell, given privacy of medical records, have pre-existing problems, that they weren't healthy kids in the
Right.
first place.
Yeah, there
And
was one example.
yeah,
If I may, it was a soccer player, and it was kind of sensational. It was more than a year ago for the poor guy. And you think, soccer player, he runs around, he's healthy, and he's dying of COVID. Therefore, it's really serious. We need to take this seriously. And not necessarily disagreeing, at least in the spirit of that message. But then it turned out, oh, he had leukemia. He didn't know it.
hello.
Yeah,
And
that makes sense.
And exactly, in leukemia of all things, it's kind of like the Colin Powell that they kind of didn't want to say, well, guess what? And I mean, people knew he had multiple myeloma. What could be worse? That's cancer of the bone marrow. I
Right.
mean, my goodness. And the
Oh,
bone
B
marrow is
cell
what's,
immunity. Yeah.
yeah, well, exactly. So depending on what political message somebody wants to send, you conveniently leave things out. And one of the big things that's found, and I can't see the audience, so I don't know. I guess you can cancel me if I insult anybody, but being overweight,
Yeah.
all of us. But fortunately, it's not just those 10 pounds. You have to have a BMI, inching up to 29, and that almost everyone in the ICU was obese. And these are the things. And, I have to, as an aside, I had written an op-ed called America's Pre-Existing Condition, Obesity. And I gave some facts about obesity, and I've written much nasty, and this wasn't a nasty op-ed. It was just really quite informational. I got trashed on Twitter because I said something about the obese being targets for scams and lose weight quick things, and we just have to look at our total nutrition. And they said, the obese, you don't like fat people, and blah blah blah. And it was unbelievable. So suddenly, to say something about being overweight is some third rail. I was surprised they didn't call me a racist. That it's like that. Magically, even doctors have gotten in trouble for telling their patients that they're overweight. And it's no.
Yeah, that could be an entire another item. And I speak as a person because it's important to identify with the out group. I speak as someone who, when COVID started, I was pretty active, but I was up at 367 pounds, and
Wow.
now I'm under 300.
Good
So
for you.
I've decided to use this time to my advantage. Obviously, a ways to go, but on the other hand, most days and certainly on the weekends, I'm out on my property because of propane prices, making sure that I've got all kinds of wood for my fireplace this year. So yes, obese is a risk factor, but very active as a mitigant to that. but I don't recall where I saw it. It may have been in relation to some of the data that came out of Florida, which was a good place for this, as they sometimes call it God's waiting room, where they looked at the number of people who had COVID as uh, a the opposite of a mitigating factor, as a potential cause of death versus people who actually died of COVID.
Oh,
To your point with Colin Powell, everybody said he died of COVID. Well, no, he probably died of the cancer, and COVID was just a shove in the back to kind of finish off the process.
if in fact even that. Okay, looking at
Sure.
those numbers, the died with versus died of. And CDC has put these numbers out. It's not something that anyone made up. They have full charts where looking at the diagnostic codes, and that's how they decide who died of what. They're called ICD codes. And looking at the codes, only 6% of people had COVID as the sole diagnosis. 2.9 comorbid factors were with the other folks that died of COVID. And the biggest one being obesity, diabetes, and hypertension. Okay. And so looking at that number, you think, well, are the stories true that somebody put down someone who died in a motorcycle accident as dying of COVID? And, that could be an urban legend, but certainly, okay. And I want to give this number right. And I think I wrote, yes, here it is. I wrote down this number. When we look at the ethics of this, something kind of fishy was going on with all the diagnoses of COVID. Number one, never in medicine do you just call a positive test a case. And no one ever made the differentiation between having a positive SARS-CoV-2 test, which would be the faulty PCR test, or having COVID. If you actually have the disease of COVID, I mean, that's what it stands for, coronavirus disease, the cases would be much lower. But on CNN every night, you see cases. Those were just positive tests. They weren't cases. So in one sense, you don't really know unless you look at the hospitalizations, because some people who got sick never recorded themselves anywhere. Yeah, so you didn't go to the hospital. So there's a lot of unknowns in there. But nonetheless, there's not people dying on the streets of COVID as many as they tried to make it look. So instilling fear in somebody, that didn't do any good. It just made you not believe. Once you might have talked to somebody, if you weren't in medicine, and said, well, I know somebody got COVID and they weren't sick. And so is that a case or is it not a case? And there was a payment structure that was developed that if you had a code, your billing code for COVID, you got 20% more money for that patient. Now, it's a reasonable thing. Okay, you had to have personal protective equipment. Perhaps more of those patients went on the ventilator. Whatever, I'm giving the benefit of the doubt that there was a need for 20% more pay. But let's say you have a flu patient. He goes on the vent. He needs a private room, all the things that boosted up the cost for COVID. So you'll call the flu person COVID. You might not even test for the flu. Maybe it is that they really had the flu. So here's the number. Normally, this is where I'd ask if I had an audience. You'll have to be my audience. How many cases for the flu season generally do we usually get in the United States?
See, and that's interesting to start off with because of what happened with how they counted for COVID. What do you consider a case?
Well, exactly. Well, let's just say, even for the sake of argument, how many positive flu tests? And generally, See, COVID was different. More people went in for COVID tests because they kind of had to.
Right.
Whereas usually people only get a flu test if they're sick and go to the doctor. They don't go to Dodger Stadium and get a COVID test. So in one hand, you can kind of guess that the 40 million are people who actually got sick. That's why they went to the doctor and got a test. But
Right.
no matter how we define it, just to look at the number, how many cases do you normally have of the flu?
Cases of the flu. I would say that in a normal year, and I'm probably going to lowball this, I'm going to assume about 10% of the population, so I'm going to say 30 million.
40 million. You're close. Okay. How many flu cases were recorded in the 2021 season?
I seem to recall a chart that said that for all intents and purposes, it looked like flu simply went on holiday and that there were next to none.
Well, it was 800,000. So,
but still a drop
compared to 40 million.
Massive, yeah.
Exactly. So
and did it drop off, or did you just not bother to test?
Well, and this, of course, is the big question that everyone tried to bury, because the answer to it when this came out was, oh, well, people were distancing 6 feet and wearing masks, so it kept them from getting these other diseases. I think a lot of people thought it was hokum, because if it worked to keep you from getting the flu, why didn't it work to keep you from getting the COVID?
Yeah, why wouldn't it be a function of the transmittability? If flu is half as transmittable as COVID, then why wouldn't the flu logically be half of the COVID numbers, unless you simply were counting flu as COVID?
Yes, thank you. QED. And so there you go on that level.
And you pointed it out, for a lot of these things, cui bono, who benefits? And I could see people reporting flu cases as COVID. First of all, we know how much Medicare fraud there is and how much medical fraud there is in this country. This was an open invitation to people who are dark side doctors, I guess we could call them.
Yeah.
Probably more like dark side administrators, I think. There's more
administrators
who are thinking that, hey, this is a great opportunity to get more money, to people who had an ostensibly noble purpose. This is costing us more. We're just trying to bring in additional funds so that we can be in a better position to help people, which on one hand, I can understand the motivation, but on the other hand, now you're screwing up all the reporting. Now the numbers don't make sense. They've been altered.
And for us here at a pro-life conference, I have to look at it as this is not Hippocratic medicine. The Oath of Hippocrates, if you look at the words that come out of the Oath of Hippocrates, he says we're supposed to use science, put patients first, have respect for life, have integrity and confidentiality without regard to the patient's social status. So all these things are what everyone should be practicing, but obviously aren't. And, it swings us around, to this whole idea of not following the science. And obviously, and that was his first thing. He said it was our duty as physicians to teach our students and to teach our patients and to tell our patients about nutrition. I mean, he said this these many years ago, and suddenly we're not doing that. And everybody always talks about first do no harm, of course, which he didn't actually say in the Oath of Hippocrates. He said everything you should do should be for the benefit of the patient. Whoever made up first do no harm, they figure it first kind of came out in the 17th century. But be that as it may, the principle's the same. But you see so many of these principles not being followed. We saw the harm in the nursing homes and early reports of patients being put on the ventilator too early just to avoid getting respiratory spray when people didn't know what COVID was. Now people refusing to see unvaccinated patients, kidney transplants being denied to unvaxxed donor-recipient pair. Even both the donor and recipient were unvaxxed. And they may soon find out that you'd be worse off getting a transplant, being put on immunosuppressives if you had the vaccine, because now we see that in the 2 weeks post-vaccine, the immune system dips down and you might be more susceptible. So all these things certainly violate the Hippocratic Oath. And when I think of following the science, I think all the way back to the Diamond Princess. Remember the Diamond Princess cruise ship? That was our first big observational study. There were 3,400 people on the boat. There were only 20% of the people became infected. And this was a group of people, mostly elderly. They had one fellow die, and he was 80 years old. Some crew members, and the crew were going from door to door delivering trays. It didn't have the greatest ventilation system. They did have HEPA filters, but not super HEPA filters, you know. And so there you have the observation. You think, okay, you had 705 cases, and half of those were asymptomatic. So then they tested people a little later and found some more positive tests. And so then we came up with the whole issue of asymptomatic transmission. And early on, when people weren't locked down or stopped from flying or whatever, there was a huge case of one guy who was asymptomatic, but he tested positive for COVID. He came in contact with 455 people. None of them got sick. So they said, you don't transmit unless you have symptoms. So then we got into this whole thing of where did the lockdowns come from if that's true, that you don't transmit if you don't have symptoms. So why would you be locked down if you're healthy? That you stay home if you're sick. What have we been telling people for years? Not to go to the office if you're sick, stay home. We won't dock your pay. And why didn't we do that? And that's where you start to wonder, are you just not following the science, or are you trying to create a new agenda? Are you trying to create fear? What is the purpose behind it? And it doesn't seem like it's public health. And this is, again, what's an anathema to the Hippocratic Oath, that you're supposed to be helping people, not hurting them. And we all know there was increased suicides, increased drug use, decreased cancer screenings, decreased cardiac screenings, and the kids will likely be psychologically damaged for God knows how long. And so
it'll be lifetime. This is the seminal event in their lives.
And certainly given the age group, whatever age you were. My husband and I were walking down the street, and there was a kid who he looked like he was maybe 4. And we don't wear masks outside. Why would you wear a mask outside when you're out taking a walk? And he did like this. Bad man, no mask. True story. And that's sad. And so then that's where you wonder, where's the science behind that? Where's the ethics behind that? And I said the other day that if a virus wanted to really make his name in history, he'd come out during an election year.
And that actually brings me to the point I was sitting on here for a while, because you're absolutely right. We had, not trying to take any political sides, although being pro-life, I'm not sure it's a giant leap, yes, which way we would go. But you had a popular but polarizing president who was looking like he was going to probably fairly handily win a re-election with the way the economy was going. And then the virus hits. So you have the in-party, the party in power, react vigorously once they kind of understood the seriousness, because there was a lot of questions about things. It didn't help that some countries were lying and hiding about what was going on. But then you had the other party that was like, we've been giving the perfect club. Let's start using it. And I think that people, generally speaking, would agree that that's what happened. What I think the untold story is, and I think it's just starting to come out, is with I won't mention specifically, except just in passing, Dr. Fauci, the bureaucracy was the third player that was, they're already very symptom, or rather, they would rather have one party over the other be in power. However, it was the bureaucracy that sprang into action. And when you look back at it, these are the people who had screwed up the AIDS response. Remember that AIDS was going to, I remember
Yes.
Oprah had said this, 2 billion people are going to have AIDS because it's not only a disease with male homosexuals. It's going to infect everybody and go crazy. The government completely screwed up that response. The 90s were a little quieter. They completely screwed up MERS. They completely screwed up SARS. And it was the same group of bureaucrats because, presidential candidates, they come and go. House control goes to the Democrats, the Republicans, same thing with the Senate.
Right.
Bureaucracy will stay for decades, and it's the same people again and again. And there you have Dr. Fauci, who had basically put together a lifetime of, maybe this is harsh, but of screwing up, which is something bureaucracies do best because they worry about defending themselves and justifying themselves and growing at the expense of whatever comes up. And that's where, against a political backdrop, a bunch of petty bureaucrats had power, the kind of power that usually only belongs to elected officials. And they're still not done with us.
Well, it's interesting. I'll speak to you in 2 points. One, Dr. Fauci, I was right there on the front lines of the AIDS epidemic. I was working in West Hollywood that had a large gay population and saw the patients even before it was called AIDS. It was called GRIDS, gay-related immunodeficiency disease.
Yeah.
And so I was very involved in the crosstalk of AIDS. And there is a sulfa drug called Bactrim that, again, wasn't specifically made for pneumocystis carinii pneumonia, but it seemed to work. And giving it to AIDS patients prophylactically seemed to keep them from getting this PCP pneumonia.
Mhm.
The big AIDS activist, Larry Kramer, had actually gone to Fauci, literally begged to publicize. Remember, we didn't have Twitter. We didn't even have email and the internet back
Right.
then. So the only way doctors could find out stuff was letters to the editor and journals and whatnot. So you needed a big megaphone.
Mhm.
And Dr. Fauci would not provide it. He said, there aren't randomized controlled trials. We'll just wait for the AZT. And that was his pet drug. As it turned out, AZT was toxic, it killed people, and it didn't work. And what does that sound like to me? It sounds like his pet drug of the day now, remdesivir. And he's doing the same thing with the hydroxychloroquine, the ivermectin. And these are drugs that there's actual mechanisms of action. In fact, Fauci's name is even on one of the studies back with the first SARS using chloroquine. Now, granted, it was in the petri dish. Using chloroquine, it stopped the SARS virus from replicating. That was the original SARS virus.
Yeah,
So
it was the
research had already been being done.
but
So
it
to
was the
shut it down,
bureaucracy that shut down all these possible alternatives. And then
exactly.
again, for political reasons, then they picked that up. Like, just recently, what was it? The podcaster Joe Rogan, who had been treated with ivermectin. Now, I'm not going to pass any judgment on that
Right.
specifically. What I'm interested was the reaction, which is where major media outlets refer to it as a horse dewormer in order to immediately discard it and not only discard it, make use of it look like this fringy, weird thing that never in your right mind would ever do it. But calling ivermectin horse dewormer is like calling water a fire suppressant.
Well,
It's like,
and here another factoid. It was 2 fellows who invented ivermectin got the Nobel Prize because
exactly.
its 3.7 billion doses had treated river blindness and other parasitic diseases. But
In people.
now, okay, here's two things I know, because we're getting up to my time. They'll be
Yeah.
so sick of listening. That big pharma gets $171 million of lobbying money, equally split between the parties. 171 million. Okay, keeping that in the back of your head, and not to mention that the AMA has its foundation and they have these levels, gold and silver. Guess who's the gold level donor? Pharma. Guess who are silver level donors? Pfizer, Merck, Bristol Myers Squibb,
Right.
you name it, they're the silver level donors. And then you wonder why people are brainwashed into using all these drugs. So, interestingly, okay, one of the mechanisms of action of ivermectin is that it's a protease inhibitor. So it stops the enzyme, that's going to go in and help the virus replicate. Guess what? Merck, who distributes ivermectin, who put the kibosh on it, so you have to go find it all over the world if you want it. Guess who's putting out a new COVID pill? Merck.
Right.
And guess what the pill is? A protease inhibitor.
Funny how that works.
Yeah. So these are the things that I'm not going to say. I just tell you a fact, and you can draw your own conclusion that money talks, cui bono, that there you go. And this is what's so sad.
I have to say, I don't blame the big pharma. I always hate the big in something after it to be evil, but pharmaceutical companies to me, they're not complicated. They're planaria. They're flatworms. They're responding to stimulus, and they're responding to whatever benefits are being squirted their way by the politicians. I actually think that if somebody was going to be impartial, what they would find out is the big story was honestly the part of it is going to have to be the Chinese reaction that gave it such a boost out into the world, but it'll be how the health bureaucracy in this country was basically, with its history of failure on many of these kind of pandemic sort of things, was put into the driver's seat and allowed to go ahead and hit the gas. And if there's anything that anyone will tell you about bureaucrats, and I'm sure you know this through your life, it's like, boy, they hate to give up that power.
Oh, once they get it.
Because as a bureaucracy, they don't have accountability for all the things that you mentioned. And I hate to pick on Dr. Fauci personally, because there's lots of other Faucis in that organization. But for any of the things that he did, like with the AZT, when were there consequences?
But there's never consequences.
Exactly. If something really bad happened at Merck, you'd see heads roll because it's a private organization and they have to do something, even if it's just kind of their, sacred cow. We'll sacrifice a couple people and hopefully you'll think we did enough. But in the case of the bureaucracy, all that happens is that, well, we clearly need more money in order to do better research, and failure works for them as a growth model.
And so then it's not even, they don't even fail, because look at what happens to them. Dr. Birx went on to be on the board of, some pharmacy related company.
Right.
What's his name? Han from the FDA is on the board of, I believe, Pfizer. Don't quote me, but I think it's Pfizer. So then there's that revolving door. So even when they lose, they win.
Yeah, so it's like when you see a congressman. I actually personally kind of liked him, Bob Dole, who, when he failed as a presidential candidate and left office, what did he do? He stopped right into a lobbying firm and kept pulling in the big dollars, working the phones for the people he was aware of, the revolving door. So we're about at time, but I want to kind of bring this around to, I think, the point you made about the Hippocratic Oath, and kind of, it's impossible to discuss this without getting into some politics and things like that, because so much of COVID and the overstepping and the mistakes were done by bureaucrats who, unlike Donald Trump, who for good or for ill was held responsible for COVID and lost his job. I noticed Dr. Fauci's still there, even after the latest testimony that indicates he lied under oath to the congressional committee. He's still there, and I would assume he's probably going to be let to step out on his own terms because the bureaucracy always takes care of itself. But in this politicized environment where there's now Twitter and Facebook and everybody has their own giant microphone, uh, and there's so many opinions, most of them being wrong because that's what opinions generally are. How can a doctor maintain an ethical or pro-life framework using things like the Hippocratic Oath as a baseline of behavior? How can they chart a reasonable course for their patients in the midst of all these noise and all these influences?
It begins with one remembering that the oath is there. Now, of course, doctors have a problem because they're licensed by medical boards. And some of the medical boards were tying doctors' hands. Some medical boards wrote nasty letters to the licensees saying, be careful how you use off-label medicines. And it was kind of a threat. Some actually went through with the threat. Others have now started lightening up and saying it's your judgment how you take care of a patient. And part of the real problem is public health is still king because they've continued to call COVID an emergency. And under an emergency, public health can actually dictate medical actions. Now, people are not going into doctors' offices, and I call them freedom practices. There's doctors out there that will listen to the patient, talk to the patient, will give early treatment, are willing to discuss with the patient, do you want to try this, do you want to try that, etc. And we have to remember that we're still the boss with the patient, two bosses working together. But the doctor has to work within the constraints of what the state licensing board said. Now, the licensing boards are starting to shut up a little bit about it, but the AMA, with some pharmacy association, came out and had a horrible statement about not using ivermectin, and which was interesting to me, and I've written this up, is as where's the outrage? I'm going to read you something. Now, mind you, this is after the AMA said, do not take ivermectin. It's not proven. There's no studies, even though there's at least 165 studies. This is what they said when it comes to abortion. Restricting what type of information physicians may share with those whom they are trying to heal is a clear violation of patient rights. Doing so impedes the journey to recovery and wellness. So this is the statement when it comes to abortion. They made a similar statement discussing transgender issues. Decisions about medical care belong within the sanctity of the patient-physician relationship. As with all medical interventions, physicians are guided by their ethical duty to act in the best interest of their patients and must tailor recommendations to each patient's circumstances. So we have to remember those words. If they could say that about abortion and transgender issues, that even in the midst of a public health crisis, which we all know is no longer a crisis, we can still remember that we're there to tailor our recommendations to the individual patient. And the hard part is getting beyond all the noise with social media. And doctors can be just as bad as lay people. They're busy. And I mean, talk about a whole nother conversation, that getting into all the electronic medical records and buying up all the individual practices. 53% of doctors are hired by somebody now and don't have an individual practice. So they've got to do what the piper says to do. And 7-minute visits with patients, all this stuff plays into what's going on in a 7-minute visit. How do you have a big discussion about what to do about COVID? And should I take hydroxychloroquine, ivermectin, or, many of these other things that are out there. So all of that kind of fits in together. So they have that same 5 minutes at the end of the day to read, oh, what the public health guy put out today. And then that's what they read. They aren't doing the deep dive. They aren't doing even the kind of dive that you're doing. And that they're stuck with some conclusion of a public health expert, your buddy, Dr. Fauci. And we have to remember, Daniel Webster, said years ago, good intentions will always be pleaded for assumption of authority. They say they'll be good masters, but they're still your masters.
No, very, very true.
End with that.
And on that, I think that we've actually, I think, just about hit an hour. You always know that's a good thing with doing one of these, when you kind of look down, it's like, oh my God, we've been talking for this long. So I'd like to say, first of all, we left a number of topics, I think, that lying there unjabbed at in more detail. So I certainly hope that we'll have the opportunity to have more discussions like this to share with the LifeTech audience soon. But on behalf of LifeTech, I'd like to thank you for taking some time out and discussing, so I think, some fairly fascinating issues around what we're dealing with COVID. We appreciate the time that you're taking, and appreciate the time that you're spending here. And I know that I got a lot out of this. I think this was a fascinating discussion. I'm sure the viewers do as well. So thank you very much for your time. Is there anywhere, if somebody was more interested in the op-eds and things that you've done, is there a place that
Sure.
they could go or to search to find more of your work?
Yes, you can go to Marilyn Singleton, MDJD.com. And if you want to look for doctors who are willing to have long discussions about this in your area, go to aapsonline.org, and right on the left-hand side of the home page, it says early COVID treatment, and you just click on that box, and the sentence underneath says find doctors who give early treatment, and you can click that on. And we also have our full list of independent doctors, people who aren't paid by the hospitals, that they have their own private offices.
Outstanding. All right. Thank you, of course, to our viewers who are looking at this video. We hope you got as much out of it as I personally did. So thank you, and look forward to seeing you watching more LifeTech videos in the future. Thank you.